slide, start from beginning. Okay, so we're looking at oncology and immunological diseases, right? So when we think about neoplastic diseases, in this slide, I put like all the different kinds of cancers that I've seen mostly on the NCLEX. Obviously, you guys know I can't put everything, right? But it doesn't matter what the disease is, as long as you know where it's located, where the cancer is, it will tell you what the problems are going to be, right? But it also doesn't matter which kind of cancer it is. Most of the solution or interventions are going to be similar, right? So neoplastic disease, meaning that there's a proliferation of some kind of cell, something's wrong there, right? So what else? So the immune system response sometimes fails. It's rapid cell division, right? Sometimes the problem is in situ. It affects the area where it started, but sometimes it metastasizes to another area, and the way they'll be able to tell is once they take a biopsy, they can tell you, oh, this is lung tissue in the stomach, in the bowel, in the bladder, I don't know, right? So that's something to remember. What else? The staging. What are the staging? Tell me about staging. Mm-hmm. How many stages do we have? Four. Mm-hmm. And what do they tell us? What does staging tell us?
4 is the worst.
4 is the worst, right? 4 is the metastasis part. Okay. So from 1 to 3, we can do something, right? 3 is hard. 2 is not as bad. 1 we can definitely rescue. But 5, can we do anything? Most likely not, right? 4 is maintenance, right? Giving them the best quality of life, palliative care, and trying to help manage whatever symptom that cancer is causing. Okay, so a lot of times we say, let's say if they have, let's see what else we're going to talk about. So if it's, depending on what the organ is what we're going to see the problems are. Okay, so therapy. So we have 3 different therapies. We have surgery. Now, usually before they do the surgery, they will want to try to do the other 2. So I should have put that below. So, right, they would do radiation. When do you choose radiation as opposed to chemotherapy? Yeah, if it's a specific spot that you see and it's a little ball here, we could just pinpoint that and call it a day. But if it's more like dispersed and it's in multiple areas, we can't do much with the radiation. What's the difference between radiation, other than the localized, and chemo? What are some things that happen in radiation that doesn't happen in chemo, or happen in chemo that doesn't happen in radiation? Yeah, you lose your hair in radiation. You don't lose all of your hair. You might lose the hair in the spot where the radiation is being done. Now, in losing hair, when you lose hair in radiation, does it come back? No, that hair doesn't come back. But chemotherapy does come back because they burn the cells in radiation, right? And the other thing too with radiation is, whereas chemo, there's no specific care, oh, don't put lotion, don't put wash with soap, There's none of that with chemo, right? But with radiation, there is a specific treatment for that area, right? It's usually marked, and they say, don't put lotion, don't be abrasive because it's sensitive, treat it a certain way. Let's say the person has, let's just say, bladder cancer, they can put the radiotopic something inside the bladder. What are some precautions do we need to do with that we might not need to do with the laser radiation?
Do something special with their pee.
Yeah, right, because the pee is now radioactive. So they're gonna pee into a metal bowl, right? We don't touch the pee. And what else is gonna be radioactive? Possibly their sweat can be radioactive. So even their clothes, like when we touch, we put everything in what? Biohazards, right? Because it's radioactive. We don't want it to be out anywhere. How about the nurse that's taking care of that patient? What? Yeah, they wear a badge, right? And they can only be in that room for how long? I think as much as 30 minutes, if a little bit over, not more. Like, it might have been changed, right? But they can't be there long. We have the time because your exposure matters. They can't have all these visitors coming in, right? But they can. It's just timing, right? So they're going to be immunocompromised, so we're going to be careful with bringing flowers and, making sure they're masked, all of these other things too. But mostly is if it falls out. What if it falls out? They pee it out. What do we do with it? We pick it up with tongs. We don't pick it up with gloved hands or anything like that, right? So that's important there. So now chemotherapy, what are some things we need to know about chemotherapy? We lose our hair, we said that. Mm-hmm. It prone to infection because what do we do to them? Yeah, the immunocompromised, so they're more prone to the infection. Yes. What else? Nausea and vomiting. So it's killing every fast-growing cell. Hair is fast-growing. Stomach cells are fast-growing. Tongue cells are fast-growing, so they have ulcers in their mouth. So that's why we use the little swab thing. What else is fast-growing? Those are mostly it, right? Stomach, mouth, hair. Those are the main ones, right? So we, let's see what else. They have pain, and they're fatigued a lot too. So with the nausea and vomiting, do we give them antiemetic before or after chemo? Before, because we know it's coming, right? We give it before they eat because we know it's something that just happens, right? We also want to make sure that we monitor them for how long? When they're starting the chemo. First, the same as blood. First 15 minutes, right? Same thing, right? Mm-hmm. Okay, so I think that will be it. The next ones will just be us, the different ones, and we'll cover that next class. Okay. That is all for now.